Hello, everyone. Good afternoon. I'm Priyanjali from Bladder Wellness. I'm sure today everybody is doing well. Today, we are going to discuss a very important topic, which is overactive bladder. Overactive bladder, also called as OAB, is a condition of the bladder which causes sudden need to urinate that may be difficult to control. OAB increases with age and is more prevalent in women than in men. This condition is common and distressing and may have a large impact on the quality of life of the patients. A doctor, such as a urologist, can treat this condition and help the patient get relief. To educate us more on OAB, its diagnosis, treatment, and prevention, we have with us Dr. Ankur Arya from New Delhi. Dr. Ankur Arya, MBBS, MS, MCH Urology, is a consultant at the Department of Urology and Renal Transplant at BLK-Max Super Specialty Hospital. He has a rich experience in the field of urology and has performed various critical surgeries and treated his patients with utmost care. So let us dive into the topic and understand more on about OAB from Dr. Ankur. Over to you, sir. The first question for you would be, what is overactive bladder, or what we commonly call as OAB?
Yeah, thank you for giving a nice introduction. The overactive bladder per se is a very annoying symptom. It is actually symptom complex. So most commonly, as you told, it is most commonly in female age group. That is it's very common in near the 20s and 40s. And overactive bladder is a symptom complex in which patient is having a irresistible urge to pass urine again and again. So frequency of the urine used to get increased, and some people are having a difficulty in controlling the urine. There could be some leakage of the urine, which we used to call incontinence. So socially, if we see, it is very annoying symptom, and patient used to go to the washroom very frequently, like after every half an hour, 45 minutes, and even in the night time, there is an irresistible desire to pass urine. So it is very bothersome. It impacts the quality of the life, and even the working hours will be lost due to this troublesome disease. So it is not a cancer, it is a benign disease, but really it is a very annoying and it requires a proper follow-up and the long-term treatment. Yeah.
So, what can be the basic cause behind this, doctor? And which is the age when somebody should be particularly careful that he or she mainly can have this condition?
If you see the major etiologies, see it is basically idiopathic, but these are the precipitating factors for the overactive bladder. And it
Hmm.
may mimic some like other diseases also, which I enumerate. So, like taking excessive smoke, doing the excessive smoking, which is increasing nowadays. As you asked me, why in the female age group? So, incidence of smoking and the obesity is now increasing in the female sex also. That's why the incidences are more overactive bladder is more in the female. Age group wise,
Hmm.
if we see, the most of the patient used to come in second decade or third decade of the life, like 20 year of the between 20 to 30 year of the age. But it may affect
Right.
any age group, like 40, 50s. And major precipitating factor, if per se, these are the excessive smoking, alcohol, caffeine consumption, obesity. Diabetes is really a precipitating factor because now there is a real and endemic in India. If you see the diabetes, and now the
Hmm.
awareness is increasing from the obesity point of view, because initially nobody is treating obesity like a disease. Now people are
Right.
much more aware, and due to the invent of the bariatric surgeries, so there is a more control of the obesity and the diabetes. So incidence may come down in the future, but nowadays due to all these morbid factors, we are getting more patient with the overactive bladder.
Right.
Yes.
Right. So, doctor, how does the initial stage look like? I mean, the main issue with any condition, any disease is identifying the disease. So, how does one know in the initial stage that he or she is having a, condition of overactive bladder?
Yeah, very good question. So the overactive bladder initial symptom is just like a simple urinary tract infection, in which the patient used to complain increased frequency of the urine. Sometimes there is a burning while passing urine. So we used to do all
Hmm.
the urine examination just to rule out the infection. And most of the time,
Hmm.
we used to see that there is no infection in the urine culture. Empirically, we used to give some course of antibiotics. And if the patient is still not responding to all these things, then we used to label the patient as overactive bladder when there is a continuous symptoms at least for a period of 4 to 6 weeks. Before that, we
Hmm.
can't label the patient as an overactive bladder, because sometimes there is an inflammation of the bladder, which we used to call cystitis, in which there is an
Hmm.
inflamed bladder lining. So that is a transient episode, and sometimes patient used to get better within the 1 month. So if the symptom
Hmm.
lasts for 4 to 6 weeks or more than that, then we used to label this patient as an overactive bladder.
Right, right. So I think this is one of the main identification that the condition would last for at least around 4 to 6 weeks. So
Yes.
also we see not only children but elders also, especially the age group which you have mentioned, 20 to 30s. We see that there is a condition where people are seen to be, bedwetting. So can this also be another reason we see people who are not able to understand that they are doing this, but actually it's happening? So can this be the reason? Can overactive bladder be the reason behind this bedwetting, or what we see in the patients or people?
As I have explained, it could be due to the overlying symptoms, like if there is an increased frequency of the urine, sometimes there is a nocturia, that is the increased frequency of the urine in the night time. So if there is
Hmm.
a decrease in the small bladder capacity at the later part of the disease, so it can lead to the leakage of the urine in the night time.
Hmm.
So yes, really we should keep in the mind that bad wetting could happen in the overactive bladder also. So one should be aware about that.
Right, right. So people who are taking it lightly and they are thinking कि आज हो गया होगा, कि सपने में हमने कुछ देख लिया ऐसा. Normally we blame the dream कि आज सपने में ऐसा कुछ देखा तो शायद हो गया, and then धीरे धीरे वो आप देख रहे हैं कि कंटिन्यू हो रहा है, चाहे हफ्ता भर या 2 हफ्ता भर वो कंटिन्यू होए जा रहा है. Then the first thing you should do is go and consult a expert. Visit your nearest urologist and let the person, the expert, judge कि क्या condition, क्या problem हो रहा है आपके शरीर में, ना कि आप self medication की ओर जाए. This is what we always suggest our patients. Speaking about OAB, doctor, what are the treatments available currently which we can talk about today?
Hmm. See, overactive bladders, first we used to do the behavioral modifications, like lifestyle modifications. The patient is having excessive weight, then we used to tell the patient about the weight reduction regime. We used to refer the patient to the dietitian for the proper dietary regime and proper exercise, and with the decreased caffeine intake, decrease alcohol consumption, and stop the smoking. And like consumption of the spicy food should be on the lower side. So these are the some behavioral modification that is required in the initial part of the therapy. But as a patient point of view, patient used to want to get relief at as early as possible. So we used to add some
Right.
medication and tell the patient, see, this is not the only treatment apart from the medication. The patient should follow the strict regime. Some patient, like I'll tell you, there's some patient who used to consume 4 to 5 liters of water in a day. That is normal for
Hmm.
them. And then they used to come with the
Hmm.
history. They are going to the washroom again after every 1 hour, 1.5 hour. So proper
Hmm.
voiding diary and the fluid intake
Hmm.
history is very much important. If the patient is
Right.
taking 4 to 5 liters of water, then we used to curtail down the fluid intake. We used to tell them,
Hmm. Hmm.
you please consume only 2 to 2.5 liters of water. That is physiological and that is sufficient for the
Right.
eh, normal human being. But they are having a
Right.
myth, like for the stone prevention, they have to take excess amount of water. So the urine color should be light yellow to white in color. That will guide how much fluid you want to take. So there is
Hmm.
no need to take 3 4 liters of water unnecessarily. It will cause a vicious cycle in which patient will go to the washroom again and again. So this is the one of the
Right.
reversible factor. First of all, voiding diary is very much important. How many time patient is
Hmm.
going to the washroom and how many time patient is consuming a tea, coffee, amount of that fluid. So proper history taking is very much important. And still, if the patient is having persistent symptom, then we used to add some medication which control the bladder activity, which we used to call anti-muscarinic group of the medications. Yes. So apart from the behavioral modifications, simple drug regime, which is required for at least period of 1 to 1.5 month, 2 month, that is required for the management.
Right. Now let's dive a little more into this topic, doctor. Urination के बारे में हम बात कर रहे हैं. There is a tendency of visiting the urination very rapidly. So we see a lot of patients जिनको आता है टेंडेंसी यूरिनेशन का, बट व्हेन दे गो फॉर इट वो देखते हैं कि फुल्ली दे आर नॉट एम्प्टिंग देयर वेसल्स. तो क्या ये भी एक सिम्टम है ओवर एक्टिव ब्लैडर का कि दे ऑलवेज फील कि नहीं, थोड़ा सा बाकी रह गया है, पूरा अभी कंप्लीट नहीं हुआ है, एंड देन थोड़ी देर बाद अगेन दे विल फील लाइक गोइंग फॉर द यूरिनेशन? कैन दिस बी आल्सो अनदर कंडीशन?
So yes, we used to confirm this because always we used to do the ultrasound just to confirm how much urine is remaining behind after passage of the urine. Because in the
Hmm.
later stage of the disease, I'll say, and also in the postmenopausal female, sometimes there is a
Hmm.
urethral syndrome and there is a tightening of the urinary passage also. So there is a overactive bladder and there is another pathology associated due to the age factor, that is the tightening of the urinary passage. So patient is having thinning of the urinary stream. Patient used to go to the washroom again and again, and they used to retain ample amount of the urine inside the bladder, which can cause the kidney failure also because there is a back pressure. It will go back into the kidney due to the reflux, and it may lead to the kidney failure in the long run. So always we used to confirm on the ultrasound how much is the residual urine. That we used to call
Hmm.
PVR, post void residual urine. And if that is
Right.
significant, then patient may require some other added maneuver, may require some dilatation, that is a OPD procedure, dilatation of the urinary passage and local examination. So proper evaluation, history taking is very much important. So sometimes there is a
Right.
overlapping of two pathology, but per se, if I say overactive bladder, pure overactive bladder, if it is comparatively in the younger age group, usually there is a less amount of the residual urine. It is not significant.
Hmm.
And when it is
Hmm.
in the elderly age group, then yes, patient could be having a significant amount of the urine.
Right, right. So, doctor has already mentioned that too much of water intake is also not good. Too much of anything is not good. Excessive of anything is
Yes,
not good
yes,
for our health.
yes.
People who are wondering कि urgency आ रहा है, जा रहे हैं, then we are not able to urinate properly. तो और थोड़ा सा पानी पी लेते हैं. शायद we are not taking the water जितना हमें पीना चाहिए उतना हम पी नहीं रहे हैं, तो उसी चक्कर में बहुत ज्यादा पानी आप पी रहे हैं. तो आपको अभी पता चल गया कि ये बिल्कुल भी सही नहीं है जो आप अपने हेल्थ के साथ कर रहे हैं. पानी भी ज़्यादा पीना सही नहीं हो सकता है, जितना आपके क्लाइमेट के हिसाब से, आपके वेदर कंडीशन के हिसाब से जितना आपको पीना चाहिए. ऑल्सो जितना आप काम कर रहे हैं, अगर बहुत ज़्यादा स्वेटिंग हो रहा है, आपका आपका काम बहुत ज़्यादा फिजिकल लेबर इन्वॉल्व करता है, तो ऑफ कोर्स थोड़ा नॉर्मल पानी इंटेक आप थोड़ा ज़्यादा कर सकते हैं, बट नॉट नेसेसरी कि आप बहुत ज़्यादा डबल कर दे रहे हो अपने इंटेक को. दैट कैन ऑल्सो पुट एन एडवर्स इफेक्ट ऑन योर हेल्थ. मूविंग अहेड, डॉक्टर, ट्रीटमेंट ऑप्शंस के बारे में हमने जाना है. ये महिलाओं में अक्सर क्यों देखा जाता है? व्हाई डू वी सी दिस मोर प्रेवलेंट इन वुमेन? व्हाई आर दे सफरिंग मोस्टली?
See, in the female, if I say, because as the incidence of the smoking, if you see the incidence of smoking is also increasing in the female, especially in
Hmm.
the metropolitan city, and the
Hmm.
obesity incidence, I will say, is more now in female population due to the hormonal profile, that is estrogen.
Hmm.
And so these are the few factors, and especially in the if the patient is having history of normal delivery, normal childbirth, so that used to weaken the pelvic floor muscles. So with overactive bladder, they used to have leakage of the urine. So these are the few of the
Hmm.
factors. I'll not say it is only in the female. Even the male patient is
Hmm.
also getting affected by the overactive bladder. But these are the few of the factors, like incidence of the diabetes, weight, and the obesity, smoking incidences. So these are the few factors. That's why we used to get more patient in the female as a female for the overactive bladder.
राइट. डॉक्टर, यू मेंशन डायबिटीज. तो हम अक्सर देखते हैं कि डायबिटिक पेशेंट में कोई भी कंडीशन हो, कोई भी बीमारी हो, क्योर होने में इट टेक्स अ लिटिल मोर टाइम. तो ओवर एक्टिव ब्लैडर में भी ऐसा ही है? आर दे सफरिंग अ लिटिल मोर देन द यूजुअल पेशेंट्स? क्या उनके लिए भी क्योर होना थोड़ा ज्यादा टफ है?
Yes, definitely. See, major cause of the overactive bladder, if we say diabetes, in diabetes there is a irritation of the nerves, so which used to
हम्म.
control the contractions of the bladder. So even if the normal patient used to feel the urge to pass urine when there is approximately 200 300 ml of the urine inside the bladder. But in diabetic,
Hmm.
what happens? The actual capacity is not small, the bladder capacity, but it used to irritate the nerves when there is the accumulation of the 50 to 100 ml of the urine. The patient used to feel the urge to go to the washroom. So
Hmm.
actual capacity is okay, but the physiological holding capacity that become less due to the irritation of the nerves. And especially in the
Right.
population, if the diabetes is not controlled, it used to increase the symptom. So apart from the treatment of the overactive bladder, as I told, the dietary modifications and the control of the diabetes is very much important. So it used to go hand in hand. The patient is not controlling the diabetes, whatever medicine we will give, it will not be so effective in the diabetic patients.
Right. डाइटरी प्रिकॉशंस के बारे में हम बात कर रहे हैं डॉक्टर. व्हाट डाइट डू वी नॉर्मली सजेस्ट द पेशेंट्स हु आर सफरिंग फ्रॉम ओएबी?
See, they should consume less spicy foods because spicy food, it used to contain the chemical which used to increase the irritation of the nerves, which control the bladder contractions. Increase caffeine intake. These are the diuretics, and caffeine per se, it used to cause the irritation of the bladder mucosa. So there is an increase in the irritation of the bladder, which used to call increased contractions and increased frequency of the urine. And we should decrease the salt intake, decrease alcohol intake, okay, and the smoking specifically. We should decrease the smoking consumption, doing smoking. So these are the few factors like oily foods, spicy foods, salty foods. Patient should decrease this consumption to prevent the worsening of the symptoms.
Right. Any other food which can trigger OAB? Just food.
See, too much of citrus fruits like oranges, patient should avoid, and the
Right.
spicy food. These are the few specific. See, this is a whole group of the foods. I can't say that a particular food will give rise to the or will precipitate the symptoms. But per se, the
Hmm.
spicy food intake, oily food intake, okay, should be avoided. Should be avoided. Yeah.
Right.
And the
Right.
citrus fruits
So
also. Yeah.
yes, yes. So anyhow, these things are not good for our health. Anyhow, we hear doctors saying कि too much of caffeine intake is not good. Too much of spicy food is not good. Of course, salt should be taken in limit. We'll also talk about that today. डॉक्टर, कैफीन के बारे में अगर पर्टिकुलरली हम बात करें, बिकॉज आप आज बहुत फोकस कर रहे हैं कैफीन इंटेक पे, ऑल्सो टी कंजम्पशन पे. वी बिलोंग फ्रॉम इंडिया, वी लव आवर टी,
Yeah.
वी लव आवर कॉफी. आजकल जितना परसेंटेज ऑफ लोग चाय प्रेमी है, उतने ही कॉफी कॉफी के लवर्स भी बहुत ज्यादा है. तो it is very tough for them to avoid tea and coffee. At least I know my family members जिनको आप खाना नहीं दो तो चलेगा, पर चाय टाइम पे बिल्कुल चाहिए. तो क्या और क्या उपाय है उनके लिए कि वो लोग चाय भी ले पाए, और थोड़ा सा अपने हेल्थ के लिए भी ध्यान रख पाए. सो विच वुड बी द परफेक्ट टाइमिंग टू हैव दैट टी, एंड हाउ मच टू हैव, अगर लेना ही है, in case, um, as we are talking about caffeine and tea. I know a lot of people जिनका हेल्थ खराब हो जाता है चाय नहीं लेने से. they'll have a
Mhm.
headache maybe. शायद डाल लिया उनके दिमाग में, इनबिल्ट सिस्टम में आ गया है उनका कि चाय नहीं पिएंगे तो हमारा दिन नहीं कंप्लीट होने वाला है. सो व्हाट सजेशन डू यू हैव फॉर देम?
See, for those patients who are consuming excessive amount of all these things. So first of all, I used to tell them because they used to have increased frequency of the urine specifically in the night time while getting going to the bed and there is a leakage of the urine. So I used to tell them before 6 o'clock, it is better if they want to take.
Hmm.
So they should take before 6 o'clock in the evening because these are the diuretics, increase the amount of the urine, volume of the urine. Okay, and you can decrease the quantity. They can take like 2 to 3 times in a day, but decrease the quantity, maybe half glass of cup or half cup is sufficient. Some people are taking full glass of tea, coffee. That is not good. See, too much of consumption, I mean to say, they used to they can take, but in a minimal amount.
Right.
Like if you say
Right.
there 200 ml used to come 150 to 200 ml of cup is there, they can take half cup at a time. And 2 to 3 times is okay, but it is not 5 to 6 times. As you increase the
Right.
frequency of the intake, so they will go to the washroom again and again. So
Right.
somehow they have to control, but 2 to 3 times is okay and in minimal amount.
Right. वेल सो व्हाट वी कैन डू इज हम धीरे धीरे कोशिश कर सकते हैं उसे कम करने का. नोबडी इज आस्किंग यू टू स्टॉप इट इन वन सिंगल डे. यू डोंट हैव टू डू इट. आप धीरे धीरे कोशिश करो. एवरी डे ट्राई कि थोड़ा थोड़ा आप उसे कम कर रहे हो. और आई एम श्योर ये आपके हेल्थ पे डेफिनेटली इफेक्ट करेगा. एज वी हैव आवर एक्सपर्ट टुडे एंड हम बार बार फोकस कर रहे हैं कैफीन इनटेक पे एंड कंजम्पशन ऑफ टी. थोड़ा सा कम होना जरूरी है. विथ एज आपके शरीर में बहुत सारे चेंजेस आ रहे हैं. दिख रहा है आफ्टर ट्वेंटीज, आफ्टर आफ्टर इन योर लेट ट्वेंटीज के बाद आप देख रहे हैं शरीर ड्रास्टिकली चेंज हो रहा है फॉर वुमेन स्पेसिफिकली. तो थोड़े थोड़े चेंजेस अगर आप करेंगे तो डेफिनेटली आपके हेल्थ के लिए बेटर होगा. लाइफस्टाइल चेंजेस के बारे में भी हम बात करेंगे. डॉक्टर, स्ट्रेस का कोई रोल है इसमें? We see a lot of conditions, lot of diseases are caused from stress. So any connection with OAB as well? Does stress has any direct connection with OAB?
Yeah, so that's a very good question. So stress is also a very precipitating factor. See, per se, it is not a cause, but it used to precipitate the symptoms. So because disturbance, stress used to cause disturbance in the sleep cycle. Because normally we used to observe when we are not doing anything, like if we are not getting a proper sleep, then at that time also we used to feel the urge to pass urine again and again. So we used to ask the history when the patient used to tell us, like they used to go to the washroom 3 to 4 times in the night. Then used to ask how much is the sleep and do you have any stress, overlying underlying factors. Because inadequate sleep will also lead to the overactivity of the bladder because there is a release of the hormones in the body which used to cause decreased absorption of the fluid from the kidney, which used to produce more urine. So stress is definitely a factor, especially if you see the today life. People are so busy. There are some interpersonal conflicts. So there's so much
Hmm.
of stress factors. So proper counseling is important, and sometimes used to counsel the patient to meet the psychologist. So for the proper counseling, if they are having a underlying stress. So
Right.
stress management is necessary. Yes, definitely.
राइट. राइट. स्पीकिंग अबाउट स्ट्रेस, आई थिंक कोई भी कन्फ्लिक्ट अगर नहीं भी हो, बट हमारा सराउंडिंग ऐसा हो गया है, मे बी द वर्क कल्चर विच वी हैव एट टुडेज डे. इतना प्रेशर है. चाहे आप किसी भी सेक्टर में जाएंगे, चाहे टेक सेक्टर में हम जाए, चाहे नॉर्मल एडमिनिस्ट्रेटिव लाइन में ही हम जाए, देयर इज सो मच ऑफ प्रेशर एवरीवेयर. तो कहीं ना कहीं वो स्ट्रेस बिल्डअप हो जा रहा है. आई मीन, लोग कोशिश करने के बाद भी लाइफ को इजीली नहीं ले पा रहे हैं, विच इज द रीजन व्हाई इतनी सारी कंडीशंस हमें नजर आ रहे हैं. और ऐसे कंडीशंस जो पहले हमें एक उम्र के बाद दिखता था, सपोज लेट फिफ्टीज में हमें दिखता था, वो आजकल ट्वेंटीज में ही दिखने लगा है. हमने कभी नहीं सुना कि छोटे बच्चों को डायबिटीज होता है, छोटे बच्चों को थायराइड हो रहा है. आजकल वो भी हमें दिख रहे हैं. वी सी यंग चिल्ड्रन हैविंग ग्रे हेयर नाउअडेज. तो प्रीमेच्योर ग्रेइंग भी आजकल इतनी कम उम्र में हो जा रहा है. आई थिंक स्ट्रेस इज वन ऑफ द मेन रीजन बिहाइंड दिस. डॉक्टर, व्हाट डू यू हैव टू से अबाउट दिस? कितना ड्रास्टिकली चेंज हो रहा है आजकल का जनरेशन?
No, definitely. See, it is not the overactive bladder. If you see the stress, stress is the major cause, and there is a shifting in every disease. If you see if you were to see the malignancy, like in 50 and 60 year of the age, now we are seeing the malignancy. Young patients are coming with the bladder cancer at 20,
Hmm.
25 year of the age. Okay, because there is the adulteration of the food. So quality of life is not that good as we used to see 20 or 30 years back. So there's so much of adulteration, so much of adding of artificial sweeteners, coloring agents, and due to the
Right.
modernization, as you told, because there is so much of work pressure, and especially we are
Right.
not communicating. See, even with our family members, we are not having a time. We can spend our 1 hour, 2 hour, 3 hour on the phone, on a social media, but we are not communicating. So that is a major factor. I used to think, see, we should communicate at least, and there should be some fast from
Yes.
this internet. At least in the night time, when you used to go to the home, switch off your mobile for
Yes.
at least half an hour, 1 hour, and then communicate with your family members. Nobody is having time. Everybody
Absolutely.
is on the mobile, social media. See, mental health is very much important. Apart from the physical
Yes.
health, though this is not the talk for the today topic, but this is anyhow related to every
Yes.
disease, whether it is overactive
Absolutely.
bladder. Yeah. So that is a very good question that you raised. In the today's scenario, the mental health, apart from the physical health, that that is very much important.
Right, right. It is very much important because physical health क्या हम monitor कर सकते हैं. There are our experts. काफी सारी technologies हैं
There are
जिसमें
our
हम
experts,
monitor कर
काफी
सकते हैं
सारी
हमारे
technologies हैं
physical health.
जिसमें हम
But
monitor कर सकते हैं हमारे
if you are talking about
physical
mental
health.
health, it's
But
very hard
if
to
you're talking about mental
identify
health, it's
कि
very
इसका
hard
cause
to
यही है.
identify
So
कि
we
इसका cause
always
यही
try
है.
to focus on the
So
mental
we
health just
always
because of
try
this. Just yesterday, I had a friend of
just because of
mine
this.
who
Just
was saying me कि
yesterday, I had
पता
a
नहीं किस
friend of
बात का
mine
टेंशन है पर
who was saying me
palpitation
कि
होता है मुझे. I'm having
पता नहीं किस बात का
anxiety.
टेंशन है पर palpitation होता
He
है
is
मुझे. I'm
very
having
young
anxiety.
and इस एज में ऐसा बिल्कुल
He's
भी नहीं
very
होना
young
चाहिए.
and
बट
इस
आई थिंक
एज में
जितने भी
ऐसा
लोग
बिल्कुल
हमें
भी नहीं
देख
होना
रहे हैं
चाहिए.
दे कैन
बट
रिलेट टू
आई
दिस.
थिंक जितने भी लोग हमें
अचानक
देख रहे हैं दे
palpitation
कैन
होना,
रिलेट टू
अचानक
दिस.
टेंशन होना, we see
अचानक
people
palpitation
sweating
होना,
all of a
अचानक
sudden
टेंशन होना, we
and
see people
they have
sweating
no
all of a
idea
sudden
ये हो रहा
and
है.
they
वर्क
have
काम
no
का भी
idea
टेंशन नहीं है
ये हो
उतना
रहा
ज्यादा,
है.
फैमिली का
वर्क
भी
काम
टेंशन
का भी
नहीं है.
टेंशन नहीं है,
पर
उतना ज्यादा
अचानक
फैमिली का भी
अचानक दे आर
टेंशन नहीं है.
फीलिंग कि कुछ
पर
हो रहा
अचानक
है
अचानक
और
दे आर
हार्ट
फीलिंग कि
पास हो
कुछ
जा
हो
रहा है.
रहा है और हार्ट
तो
बीट फास्ट
ये
हो
जो
जा रहा है.
एंजाइटी
तो
हो रहा
ये
है
जो
ये आजकल के
एंजाइटी
जमाने
हो
में,
रहा
आई
है
थिंक
ये आजकल के जमाने में,
ये
आई थिंक
थोड़ा सा सोशल मीडिया से
ये
दूर रह
थोड़ा
के,
सा सोशल
थोड़ा
मीडिया
सा
से दूर
स्क्रीन
रह
से
के,
दूर रह के
थोड़ा सा
अगर आप
स्क्रीन से दूर रह के अगर
स्क्रीन
आप
टाइम ज्यादा स्पेंड
स्क्रीन
करेंगे,
टाइम ज्यादा
थोड़ा
स्पेंड
सा
करेंगे,
नेचर के साथ
थोड़ा
टाइम
सा
स्पेंड
नेचर के
करेंगे,
साथ टाइम स्पेंड
अपने
करेंगे,
आप को टाइम दीजिए,
अपने आप को
अपने
टाइम
शरीर को
दीजिए, अपने
जानिए,
शरीर को
मेडिटेट
जानिए,
whenever
मेडिटेट
possible,
whenever possible,
try
Yes.
to spend
try
some
to
calm
spend some
time.
calm
I think
time.
this will be
I
very
think this will be
helpful.
very
डॉक्टर
helpful.
व्हाट डू यू हैव टू
Doctor,
से
what do you
अबाउट
have
दैट?
to
क्या
say about that?
मेडिटेशन
क्या
जरूरी है
मेडिटेशन
हमारे डे टू
जरूरी
डे
है
लाइफ में?
हमारे
जो
Yes,
डे टू डे
हमारे
जो
पूर्वज कह के
हमारे
गए हैं
पूर्वज
कि
कह के
प्लीज
गए हैं कि
थोड़ा सा
प्लीज
नेचर के
थोड़ा सा
साथ समय
नेचर के
बिताइए.
साथ
इज
समय
इट
बिताइए.
इम्पोर्टेंट?
Is it important?
see, personally used to say I always used to do the meditation at least 10 to 15 minutes. If you can find for you, that is a great thing because you have to come out from this thing. See, nobody will help you. You have to understand. See, this mental health issue. See, people can just assist you, but you have to come out from this situation. Okay, and meditation, I say it's necessary. At least 15-20 minutes of the day you should give to yourself.
Right.
So
Right.
definitely, it is very much important, and one should do all these things in a proper manner. And they can take assistance from some other, like some spiritual gurus are there. I don't know
Mm.
because there are so many gurus and pandits nowadays whom to believe. But definitely, there are so much meditation therapy then you can adopt, and definitely it will help you in every field.
Right, right.
Right.
And
Right.
on
And
top of
on
everything,
top
I
of
think
everything, I think
everybody should love
everybody should
themselves.
love
अपने आप से
themselves.
प्यार
अपने आप
कीजिए,
से प्यार कीजिए,
अपने शरीर से
अपने
प्यार
शरीर से
कीजिए.
प्यार
अ,
कीजिए.
भगवान ने हमें सब कुछ
भगवान
दिया
ने
है,
हमें सब कुछ
हमारा
दिया है,
शरीर दिया है
हमारा
हमें.
शरीर
This is
दिया
the
है हमें.
greatest
This is the
wealth
greatest
we
wealth
have. So
we
please
have.
love
So
yourself,
please
love
love
your
yourself,
body,
love your
no matter
body,
however
no
it
matter
is.
however
अपने
it
आप
is.
से आप प्यार
अपने आप
करेंगे,
से
अपने
आप
आप
प्यार
को आप
करेंगे,
समय
अपने
देंगे,
आप को आप
चाहे वो
समय
किसी भी
देंगे,
फॉर्म
चाहे
में
वो
हो,
किसी भी
चाहे वो
फॉर्म में हो,
मेडिटेशन
चाहे
हो,
वो मेडिटेशन
चाहे
हो,
वो योगा
चाहे
हो,
वो योगा
चाहे
हो,
वो फिजिकल
चाहे वो
एक्सरसाइज
फिजिकल
हो.
एक्सरसाइज
पर
हो.
आई थिंक दिन
पर
में
आई थिंक
एक
दिन में
घंटा
1
अपने
घंटा
आप के लिए
अपने आप
बहुत
के
ज्यादा
लिए
नहीं होगा,
बहुत
राइट?
ज़्यादा नहीं होगा,
तो
राइट?
इतना
तो
समय अपने
इतना
आप
समय
को
अपने
दीजिए,
आप को
आपके
दीजिए, आपकी
समस्याएं बहुत
समस्याएँ
आसानी से
बहुत
सॉल्व हो
आसानी
जाएंगे.
से
कमिंग
सॉल्व हो
बैक टू द
जाएँगी.
पॉइंट,
कमिंग बैक
आज
टू द
हम
पॉइंट,
ओएबी
आज
के
हम
बारे में बात
ओएबी के
कर रहे
बारे में
हैं.
बात कर रहे
We
हैं.
are in
We are
discussion
in
with Dr.
discussion
Ankur
with Dr.
Arya,
Ankur
and
Arya,
I can see
and
few
I can see
questions
few
coming up from
questions
the
coming up
viewers.
from the viewers.
The first question
The
comes from
first question comes from
Rohan Punawala,
Rohan
who
Punawala,
asks,
who asks,
is OAB a
"Is
normal
OAB a
part of
normal
aging?
part of aging?"
See, it is not a normal part of the aging. It can affect any age group, but definitely the incidence used to get increased sometime in the elderly
Hmm.
population. But even in the if you see the incidence, the young population is most commonly affected. In the elderly, we used to get mixed symptoms: overactive bladder with some form of obstruction. Like I explained initially, also there is an obstruction of the urinary passage. So usually the mixed symptoms in the elderly population, and in the young patient we used to get pure overactive bladder patient. Yes.
Right, right.
Right,
Also,
right.
डॉक्टर लेट अस
Also,
नो
डॉक्टर
कि
लेट
जितने
अस
भी
नो
लोग
कि जितने
यहाँ
भी
सोच
लोग
रहे
यहाँ
होंगे कि
सोच रहे होंगे कि
हमारी मम्मी पापा को
हमारी
है
मम्मी पापा
ओएबी
को
का
है
इशू,
ओएबी का
so
इशू,
they
so
also can
they
get this
also can
condition. So
get this
can this
condition. So can this
be genetically
be
transferred as
genetically
well? Is it
transferred as
possible?
well? Is it possible?
They will not say it is genetically transformed, but if they're having a common food habit, like some people, some families are having a habit of taking too much of spicy foods. I know the families,
Hmm.
they top to bottom, everybody is taking too much of spicy and this thing.
Right.
So that's why, so we have to see the food habits. Genetically, there is no as such gene that is directly correlated with the overactive bladder. But due to the particular food habits in that family, in generation, it used to affect that families much more. And people used to think there is a genetic predisposition. So, but genetic predisposition usually is not there. It is not necessary if the mother is affected, the child is also having the same thing. So it is basically the food habits and the behavioral factor. As you told about the stress, see that is also is in the family. If the mother is taking too much of stress, definitely the child will also be stressed. So these are the precipitating
Right.
factors. So one should see if these are the precipitating factors are there, one should control these things.
Right. Also,
Right.
doctor, are there
Also,
any
doctor, are
prevention
there any
strategies
prevention
how
strategies
one
how
can,
one can,
save themselves
save
from having
themselves
this
from
condition?
having this condition?
They're doing a proper, like following a proper dietary regime, exercise, decrease the weight. Okay. Even I will say 30 minutes of brisk walk in the morning is much more sufficient. Okay.
Right.
And just control the food habits. You can take the frequent meals, but don't take too much of just decrease the quantity of the meal at a time.
Right.
And
Right.
especially in the night time, if we can take 2 hours before the sleep, light dinner, that is much more than
Hmm.
sufficient. That is required. Because there should be
Right.
at least
Right.
overnight fasting of 8 to 12, 8 to 10 hours. That is sufficient. So breakfast you
Hmm.
can do like 8 o'clock, 9 o'clock, then one meal in the afternoon, and then early dinner, maybe at 7 o'clock or 8 o'clock, not beyond that. But sometimes it is very
Right.
difficult to follow because of the work
Yes.
pressure.
Yes.
But at least there should be 2 hour gap between last meal and the sleep.
Right. So,
Right.
the
So
early dinner,
the
which we
early
are talking
dinner,
about,
which we are
it's
talking
very
about,
helpful. Let's
it's
tell you
very
about
helpful.
this
Let's tell
also.
you about this
कि
also.
अगर आप जल्दी खाना
कि
खा
अगर
लेंगे
आप
ना
जल्दी
by
खाना खा लेंगे
7
ना
by
by
8 अगर
7
आप
by
खा लेते
8
हैं अपना
अगर आप खा
last
लेते
meal,
हैं अपना
it
लास्ट
can be
मील,
very
it can be
very helpful for
very
your
very
health.
helpful for your health.
Also, जितने
Also,
भी लोग बहुत
जितने भी
मुश्किल
लोग
हो रहा है
बहुत
उनको
मुश्किल हो
weight
रहा है
lose करने
उनको
के
वेट
लिए,
लूज करने के
this
लिए,
can be
this can
a
be a
miracle for you. It
miracle for
works
you. It
as
works as
magic. Let's tell
magic.
you,
Let's tell
अगर
you,
जल्दी डिनर
अगर
कर
जल्दी
लेंगे
डिनर कर लेंगे
और सुबह
और
उठ के
सुबह
टाइम
उठ
पे
के
खाना
टाइम पे
खाएंगे,
खाना
अगर
खाएंगे,
मील्स
अगर
आप
मील्स
मील्स के
आप
बीच में
मील्स
प्रॉपर
के
गैप
बीच में
रख रहे
प्रॉपर
हैं
गैप रख रहे
और
हैं
5 से
और
6 मील्स
5
ले
से
रहे
6
हैं,
मील्स ले रहे हैं,
it's it's working
इट्स
like
वर्किंग
anything.
लाइक एनीथिंग.
तो
तो
आपके शरीर के लिए भी
आपके
अच्छा
शरीर के
है,
लिए भी अच्छा है.
जो लोग वेट
जो
लूज
लोग
करने का
वेट लूज
कोशिश कर
करने
रहे
का
हैं उनके
कोशिश
लिए भी
कर रहे हैं
बहुत
उनके लिए
अच्छा
भी
है।
बहुत अच्छा
आपको
है.
एक्स्ट्रा टाइम
आपको
जिम में भी
एक्स्ट्रा टाइम
स्पेंड नहीं
जिम में भी
करना होगा
स्पेंड
कि
नहीं करना
बहुत ज्यादा
होगा कि
वर्कआउट
बहुत
करना
ज्यादा
पड़ रहा
वर्कआउट
है, वो
करना
भी
पड़
नहीं
रहा है, वो
पड़ेगा।
भी नहीं
तो
पड़ेगा. तो
बहुत सिंपल हो
बहुत
जाता है
सिंपल
लाइफ
हो
अगर
जाता है लाइफ अगर
खाना-पीना
खाना
थोड़ा-सा
पीना
सही
थोड़ा
हो,
सा सही
अगर
हो,
आपका
अगर आपका
लाइफस्टाइल थोड़ा-सा
लाइफस्टाइल
हेल्दी
थोड़ा
हो,
सा हेल्दी
अगर
हो,
आप
अगर आप
डेली थोड़ा-सा
डेली थोड़ा सा
कोई भी फिजिकल
कोई भी
एक्सरसाइज अगर
फिजिकल
आप
एक्सरसाइज
इंक्लूड
अगर
कर
आप
रहे हैं।
इंक्लूड कर
नाउ
रहे
लेट्स
हैं.
टॉक
नाउ
अबाउट
लेट्स टॉक
एक्सरसाइज
अबाउट
डॉक्टर।
एक्सरसाइज
जितने
डॉक्टर.
भी लोग, जितने
जितने
भी
भी लोग,
पेशेंट्स
जितने भी
हैं who
पेशेंट्स
are
है हु
suffering
आर
from
सफरिंग
OAB,
फ्रॉम
do
OAB,
we suggest
डू
them
वी
physical
सजेस्ट देम
exercise? Is it
फिजिकल
safe for
एक्सरसाइज?
them
इज इट
to
सेफ फॉर
have
देम टू
normal
हैव
workout,
नॉर्मल
like gym
वर्कआउट,
workouts
like
also we
gym
can say?
workouts
Is
also
it
we can
fine
say?
if they
Is
do
it
it?
fine if they do it?
Yeah, it is absolutely safe. See, there is no underlying any disease like no spine problem and there is no problem in
Hmm.
walking or something, then it is absolutely safe. So every age group I will advise, not for the only for the overactive bladder, like for the
Hmm.
heart also, and there is a liver metabolism will also improve. So 30 to 40 minutes of walk and 15 to 30 minutes, like before the sleep, if they can do the meditation, that is much more than sufficient.
Right.
So there is no as such contraindication and there is no particular exercise. But I'll say that the specific thing that I used to tell the patient, that is a bladder training and time
Hmm.
voiding. See, I used to explain my patient if they are going to the washroom like every 30 minutes, 40 minutes, I used to tell them like in a 1 week, day by day, they used to increase the duration. Like today they have to increase by 1 minute, then tomorrow by 2 minutes. So by at the end of 1 week, if I can get half an hour extra, okay, so patient can postpone the urination maybe by 5 minutes,
Right.
2 minutes, 3 minutes. So that is called bladder training. So that is a biological feedback that used to go to the brain and brain get acclimatized. Okay, as I told, in the overactive bladder there is no decrease in the capacity. Patient can hold the urine, but there is a fear of the leakage of the urine. So this
Right.
is called bladder training and timed voiding. Like the patient is
Hmm.
going to the washroom at 9 o'clock. I used to explain, please hold till 9:45, 10 o'clock if she or he can. So this is a particular regime I used to explain my patient, simple exercise. I used to tell them just squeeze the sphincter, like anal sphincter, which control the motion. So there is an urge. You have to suppress the urge. So you will get 5 to 10 minutes extra. Then you can go to the washroom again the next time. So gradually patient will improve. The symptoms will improve.
Right.
Right.
Now, let's also talk about the sodium intake or salt intake, which we are saying.
Talk about the sodium
How
intake
much
or salt intake, which
sodium or
we are
salt
saying.
intake is
How much
suggested by
sodium or salt
doctors
intake
for
is
normal
suggested
human to
by
take?
doctors for normal human to take?
See, per se, if you say the salt intake, it is just, we used to tell the patient there is no need to take any extra salt, like added table salt. We used to say, no need to add from above. Only if you are mixing in some vegetables, that is half teaspoonful is sufficient for the human body in a day. That is much more than sufficient. So no added salt should be there, ideally.
Right.
Right.
Yeah. Only half teaspoonful, that is much more than sufficient, that is required for the human body. Because we used to get this
Right.
mineral salts in everything. Yeah.
Right. Right.
Right.
So,
Right.
जितने
So,
भी लोग हैं
जितने भी
जिनको
लोग हैं
नमक
जिनको
ज्यादा खाने का
नमक
आदत
ज्यादा
है,
खाने का आदत है,
प्लीज
प्लीज
ट्राई
प्लीज
एंड लेसन
ट्राई
दिस।
एंड लेसन
ये
दिस।
कहीं ना कहीं
ये
आपके
कहीं ना कहीं आपके
बॉडी में वाटर
बॉडी
कंटेंट
में
बढ़ा
वाटर
रहा है,
कंटेंट बढ़ा रहा है
और आपके
और
हेल्थ को
आपके हेल्थ को
बहुत ज्यादा इफेक्ट कर
बहुत
रहा
ज्यादा
है।
इफेक्ट कर
ज्यादा
रहा
नमक
है।
खाना
ज्यादा नमक खाना
इट्स नेवर
इट्स
सजेस्टेड।
नेवर सजेस्टेड।
और जैसे ही
और
उम्र हो
जैसी
रहा है
उम्र
इसको
हो
और
रहा
थोड़ा
है
सा कम
इसको और
करते
थोड़ा सा
जाइए।
कम करते जाइए।
You will always be
You
in a
will always
beneficial
be in a
state. Moving
beneficial
ahead
state.
to the
Moving ahead
next
to
question,
the
which
next
comes from
question, which
Rahul
comes
Bastar,
from Rahul
जो
Bastar.
पूछते हैं what
जो
are the
पूछते हैं what are the
second line therapies
second
for
line
OAB?
therapies for OAB?
See, as I explained, the first line therapy is the behavioral modifications and the drug intake that we used to prescribe. That is a particular group of the medication that is called antimuscarinics, which decrease the contractions of the bladder. The patient doesn't respond to all these things. Then the next line of action, we used to do some specific tests just to measure the bladder pressure. That is called urodynamic study. And if we see there is an increase in the bladder contraction during bladder filling, like when the urine is accumulating inside the bladder, on this particular test, we can see how much is the pressure rise. So when there is a filling of the bladder, normally there should not be any pressure rise inside the bladder. So it is a low pressure filling. But in overactive bladder, what happens as the urine accumulates, there is an increase in the bladder pressure. So we have to control this pressure uh, by giving an injection. As you heard of Botox injection, which people used to
Right.
have for the face lifting, for some if they're having a drooping of the eyelids, Botox we used to give there also. So in urology, per se, the implication of the Botox is in the overactive bladder, those who are not responding to the medication. So this is a simple injection we used to give inside the bladder by natural urinary passage. No need to give any cut over the body. And by cystoscopy, endoscopic technique, we used to give the injection inside the bladder at multiple sites. And it's a very short duration therapy. It used to take half an hour to 45 minutes. And the next day patient can go without the urine bag. But the thing is, we have to see the effect, as patient may require a repeated injection maybe after 9 months or 12 months, depending upon the response. So this is the next line of management apart from the initial treatment. That is a Botox instillation.
Right.
Right.
Moving ahead with the next
Moving
question,
ahead with the
doctor,
next
which
question,
comes
doctor,
from
which comes
Nikhil,
from
who
Nikhil,
asks,
who asks,
what is
what is
bladder renting?
bladder renting?
What is bladder?
Bladder renting.
Bladder renting.
Renting.
Yes.
Yes.
Per se, I think you want to say some bladder stenting or something. Bladder renting per se, there's nothing like bladder renting. If there's surgical maneuver that sometimes we used to do, that is a augmentation, bladder augmentation. If the bladder is of small capacity in the late stage of the overactive bladder, the capacity is 100 ml. Then we used to apply some part of the intestine on the top of the bladder just to make it big. That is called augmentation cystoplasty. But bladder rent, I think it will be much more specified. Per se, there is no term like bladder renting.
Right.
Right.
Right. Nikhil, I
Right.
believe you have got
Nikhil,
your
I believe you
answer.
have got
The
your
next
answer.
question
The
comes from
next question
Deepak
comes from
Saxena,
Deepak
who asks,
Saxena, who
how can I
asks,
manage
how can I
OAB
manage OAB
symptoms
symptoms
and maintain
and
an
maintain
active
an
lifestyle?
active lifestyle?
See, as I told, how to manage the symptom by simple dietary regimes. and controlling the fluid habits, drug intake that we used to tell the patient for 3 to 6 months at least. The patient doesn't respond to all these things, then the intravesical Botox instillation. And the last stage is the per se for the management point of view, surgical management, that is increasing the bladder capacity by adding some part of the intestine. So these are the management options as I explained already. Yeah. So what was the second part of this question?
And maintain an
And
active
maintain an
lifestyle.
active
How can I
lifestyle.
manage
How can I
OAB
manage
symptoms
OAB
and
symptoms
maintain
and
an
maintain
active
an
lifestyle?
active lifestyle?
So by doing all these maneuvers, patient used to get 3 to 4 hours of the frequency. Then anyhow, the lifestyle will be as active as before, but patient have to be in a continuous follow-up. The compliance is very much important. See, in today's life is so fast. Patient used to come and tell us, "Doc, there's no effect even after 1 week of the treatment." Then I used to explain them, see, it is a morbid disease. At least to take 3 to 6 months of the therapy. See, that much of confidence should be there uh, for a proper implication of the treatment. So
Right.
long-term treatment is generally required in this type of the bladder, which we used to call overactive bladder. It is not a one-day
Right.
treatment.
Hmm.
Yeah.
Right. Well, moving ahead with the
Well,
last
moving ahead with
question,
the
doctor,
last
which comes
question,
from
doctor, which
Ajit
comes from
Singh.
Ajit
He asks,
Singh.
so
He
what are the
asks, so what are
latest
the latest
advancements in
advancements in
OAB treatment?
OAB treatment?
See, as I explained, the Botox. So it is not new, but it is the one of the effective treatment in which patients are resistant to all other regime, all other drug regime. And there is a special type of the surgical procedure now evolving in which it doesn't require large part of the intestine to be taken for the augmentation, for the making a bladder big. Even by doing a small part of the intestine, we can make it big. So that is a surgical part. Apart from that, there is a new therapy that we used to call sacral neuromodulation, in which we put a electrode uh, in the spine, in the lower part of the spine, just to decrease the signaling of the bladder. So the overactive symptoms due to the nerve irritation will be suppressed by that electrode. But the treatment is definitely, it is costly and it is evolving nowadays. So it is a minimal invasive option for the overactive bladder, which we used to call sacral neuromodulation, apart from the intravesical therapy as I explained earlier.
Right.
Right.
Right. So, yes,
So
this
yes,
was all
this
about the
was all
latest
about the latest
advancements.
advancements,
And we had a
and
wonderful
we had a
discussion on
wonderful
OAB
discussion on
today. We
OAB
have talked
today. We
about
have
a few
talked about
things
a few things
which are
which
related to
are
OAB,
related
which
to
are not
OAB, which
related
are
to
not
OAB,
related to
but
OAB,
somehow it
but
is
somehow
related
it
to
is
our
related
overall
to our
health.
overall health.
So,
So
after this wonderful
after this
discussion, before
wonderful
we
discussion,
take
before we
a leave,
take a
doctor,
leave,
any
doctor,
take home note
any
for
take
our
home note for
viewers
our
who has
viewers
watched
who
us so
has
far?
watched us so far?
I'll say you should maintain a healthy lifestyle and you should, for the mental health, as we explained, as we discussed in details, doing a proper exercise, decrease weight reduction, and modifying the fluid habits, proper meditation. Okay, so these are a holistic approach is required for the management of this overactive bladder. So
Right.
that was I want to explain here.
Well, thank you
Well,
so much,
thank you
Doctor,
so much,
for
doctor,
your valuable
for your
time.
valuable
That was
time.
Dr.
That
Ankur
was
Arya
Dr.
for
Ankur
us, and
Arya
it
for
was
us,
a
and it
very,
was
very
a
informative
very, very
session today
informative
for our
session
viewers
today
today.
for our viewers
And we
today.
look
And
forward to
we
many more
look
such
forward to
sessions in
many
coming
more such
time.
sessions in
And
coming
thank you,
time.
viewers,
And
for your
thank you,
excellent
viewers, for your
participation.
excellent
For more
participation.
information
For
and
more
updates, stay
information and
connected on our
updates,
FB
stay
page,
connected on
Bladder
our FB
Wellness.
page,
We are
Bladder
also
Wellness. We are
available on
also
YouTube,
available
Twitter,
on
and
YouTube,
Instagram.
Twitter,
Thank
and
you.
Instagram.
Stay
Thank
safe
you.
and stay
Thank
Stay
healthy.
you.
safe and stay healthy.
Thank you very